Hey guys, welcome to the First Principles of Medicine podcast. In this series, we will be breaking down complex medical topics into their first principles. When the stress is on and you've just been asked a difficult question that you don't know the answer to, we feel that you'll be able to fall back on these first principles to formulate a decent answer and reason your way out of trouble.
Okay, I'm going to flip it back to you, JT, now. My name's Jeanette. I'm a young 25-year-old female coming into your GP practice because I'm complaining about pain on urination. Okay, you've done a urinalysis and it's pretty pathognomonic of a UTI. What you going to do?
Well, Jeanette, thank you for coming in today. I'd love to help you with your problems. So what we see here is that you have a UTI, and it seems to be a lower UTI, so it's somewhere in your bladder or your urethra. And so what I want to help you today is help you with your pain. If you're feeling any pain, I'm going to give you some Panadol to help you with the pain down there. And then the second thing is I want to help you with your infection. So I'm going to give you some typical antibiotics for you to use, and hopefully that will help cure your UTIs. Now, the last thing that I want to do is teach you about UTIs so this thing doesn't happen again, because obviously you seem to be in a lot of pain, and I don't want that to happen to you. So just to check, I want to make sure that you're drinking enough water and you're going to the bathroom frequently, because you want the urine to keep flowing so that bacteria doesn't stay in your urinary tract, because when it stays there, that's not good. Okay? Now, I understand that you're also sexually active, so it's very good to always go to the bathroom after you have sex to make sure that the bacteria doesn't stay there and you can clean it out. Now, the third thing is if you go to the bathroom, take a number 2 to wipe front to back and not back to front, because we don't want that bacteria in your digestive tract to get transferred into your vagina, because that's another method what gives you UTIs. So, all in all, drink a lot of water, have good hygiene in general, and come back in a week's time after all these antibiotics that you take, and if you're in any pain, come back in the meantime, but otherwise I think you'll be okay. Before we wrap it up, I'm just going to give you 3 key takeaways that you can take away for this UTI episode. So first, UTIs occur when there is an imbalance in the host defense mechanism and the bacteria's infection mechanism. Number 2, bacteria causes acute inflammation of the urinary tracts, resulting in the typical UTI symptoms of urinary frequency, urinary urgency, and dysuria. And finally, urinalysis and antibiotic treatment is recommended for all patients with symptomatic UTI. That's the 3 key takeaways. Thank you everyone for tuning in. I hope to see you next time.
Thanks so much, guys, for listening to this week's episode of 1PM. If you want some more resources, please check out our Anki flashcards or our Notion documents, where you can find some links to other episodes.